Welcome to Simply Walk the Talk. Our bodies and minds adapt to what we do most of the time. If you want to change your body and mind, you must change what it is you do most of the time. This podcast explores all things health, wellness, fitness, lifestyle, and biohacking. Stay tuned as we explore various thoughts, methods, and experiences from a multitude of conversations between our interesting guests and experts through many fields of work. Sit back, relax, and enjoy the show.
Simply walk the talk. Simply walk the talk.
So here we are. Dr. Scott, welcome back, man.
It's been a while, Josh. It's good to see you. It's good to see you.
Yeah, it's I'm gonna save everyone and ourselves mainly the long intro of your background because you've been on the show before, and I think I can direct people to those previous episodes so that they can really get a chance to understand you. But one of the things that I love about our relationship is that we both have our hands in lots of different arenas, right?
Indeed.
And
yeah.
I thoroughly enjoy just calling you up sometimes just to ask you questions about the most random things. But if you don't have a solution, you always know someone that does.
Likewise, man. It's always the same for you. I mean, I remember I asked you just a couple weeks ago about my brother's ankles, my brother's kid's ankles, and he's like 12 or something like that. You're like, just go here, do this, find this. I'm like, perfect. I just like send that directly to my brother, it's his son.
Yeah.
And I was like, there you go.
There you go, man. Exactly.
Yeah.
Well, what's interesting is I think what prompted this conversation today is because we have been working together finally. We've always been doing some work with Troscriptions and
sure,
Home
yeah.
and Hope, and that's always been great. But when I finally, because I think it was about 2 years or so that I had been mentioning to you that I wanted to get myself a hyperbaric oxygen chamber.
Yeah.
And then we started going down the path of looking into it. And then I got sticker shock when you were like, oh yeah, here, look at this model, look at this. And I'm like, whoa, wait a minute. Maybe I'm not quite ready for a chamber. And then I had to kind of do the research to find the value for myself. And then when I do things like that, then I also want to help others maybe find the value in it because it's an investment. It's an investment for your health. It's an investment for others' health, right? Especially if you have a family or you have friends that come over and things like that.
Definitely. Yeah.
So
and for your family too. Yeah.
Yeah, absolutely.
Yeah.
And so that's where I kind of want to start is because you have an extensive background in a load of things. But just briefly, for those who aren't familiar with your work, if you could just maybe rattle off some of the things that you are most experienced in for now.
Sure.
And then we'll start to talk about the chambers and things like that.
Sure. So the first data point is that my father is a chiropractor for 45 years. So I've been out of the box since I was born. And he's crazy. He has a big office in Northport, New York, which is on Long Island for those who don't know. And so he's always been into all these different kinds of things since I was a kid. So that kind of gave me like let's call it my crazy base. And then I'm a board certified internal medicine physician. I've been in practice now for over just about 15 years, and I specialize in hyperbaric oxygen therapy. I've been involved in that field for over a decade. I've been doing consulting. I've worked as medical director for clinics. I live in Colorado now where I do most of my work remotely in that case. But I've kind of involved in that world. And I think really trying to move that world in a very specific way, in like an integrative type of way where it's not just about being in a hyperbaric chamber. It's also about what else you're doing before, during, and after to truly optimize the experience. And I also, in 2017, got involved with a nonprofit called Health Optimization Medicine in Practice, which is involved in creating a foundational framework for practitioners of all types to how to learn how to optimize the health of their patients and clients. And so I serve as the chief of education, vice president of education, something like that. I don't remember my title, but whatever.
Something like that.
But I'm a faculty there. And then we started the company called Troscriptions through that company in 2020, which was a way to create precision dose products, pharmaceutical grade products to help people optimize their health now while they're on the longer path of optimizing which, takes a long time for most people. So in my clinical practice, I kind of do all of those things. I focus on health optimization medicine. I focus on hyperbaric medicine. I focus on the integration and the cohesion of these kinds of tools, technologies, and practices through the foundation of health optimization medicine.
And with that, Dr. Scott, you definitely are someone that walks the talk, which is why I love having you on the show, because I love working with people that, there's people who show up and do these kind of interviews and they're very visible on social media, but then
Sure.
On the back end, if you know them personally, that they're not quite doing what they're saying that they're doing.
Of course, yeah.
But I've gotten a chance to know you for quite some time now, and you're definitely walking the talk. So I appreciate that. And I think we can go down many rabbit holes, but let's maybe start with probably the most, let's call it the most interesting of these practices that you do, which is HBOT, hyperbaric oxygen therapy. This is one of those things that some people, if they are really in a dire situation, like maybe they're battling cancer, or they've had a major surgery, or they've got some issues that maybe it's a part of their protocol, their prescription coming out of the hospital.
Sure.
They might understand I need to have that, right? And then they might then think, okay, I should carry that out and get one for my home. And we know that it's loads of money, but very worth it for those individuals. However, I also want to talk to the people who have maybe heard about it and thought about getting it, but they're not quite off the fence on one side or the other. So let's just talk about what is hyperbaric oxygen therapy, and then how can we best utilize that in our world?
Yeah. So what I forgot to mention in my little bio there is I also have a company that creates hyperbaric oxygen therapy chambers and products and technology and software that I started in 2018 because I got really tired of trying to educate people on the hyperbaric chamber that they were buying 2 or 3 years after they purchased it and had no idea how to use it, or they were referred to a facility and didn't get really good direction and then didn't get the results that they wanted overall. So I really found in around 2016 and 17, I started talking about it more and trying to start educating the community at large through various podcasts and lectures and education and things that I still do up until today. And really over the pandemic, over the last several years, as you know, Josh, things have gotten a lot crazier in very many ways, but certainly the interest in hyperbaric therapy is skyrocketed overall. And so you have a lot more companies out there talking about hyperbaric therapy, a lot more companies that have chambers and have technology coming into the United States and bringing in hyperbaric chambers as well. And so it's kind of like the Wild West for people. And I completely understand why it's a bit confusing. I thought it would be easier over time, but it's gotten harder actually, because there's just more noise there than there used to be. And there was noise before, but there's a shit ton more noise now. And so, the basics of it is that right now there's about 14 different indications that are approved in the United States to use hyperbaric therapy where insurance would cover those particular indications. Those are pretty rare though. Of those 14, only 4 or 5 of them really actually occur outside the hospital. Where I learned about hyperbaric therapy, I may have talked about this on our initial podcast about it, was when I was in medical school. I was in a trauma center and we were using hyperbaric therapy for severe wounds, severe infections, something called the flesh-eating bacteria infection, which was pretty special and very shocking in newspapers back in the late 1990s and early 2000s. And so I saw some amazing results. And then I kind of went into the details of the physiology, the history, the research. And I saw that this particular technology was being used all over the country, mostly all over the world, really, for lots of different indications that were not directly for acute care. Certainly use it for diabetic wounds, for patients that have had radiation from cancer exposure and have radiation-induced injuries. We have it for flaps and grafts in plastic surgery. So if you've had a breast cancer, for example, you've had your breast removed and you're getting a flap on your breast, you can get hyperbaric therapy if that flap is not going very well. It looks like it's not going to work. You can also get it for sudden hearing loss, which is usually a neurologic type of presentation where people have a sudden loss of hearing. But most people listening aren't going to have any of those things. But it's good to know that they exist because you can get to a hyperbaric chamber and it's going to heal. It's going to recover much more than you would otherwise if you didn't get into a chamber for those particular reasons. But yeah.
And I don't mean to throw
ahead.
you off that line of thinking, because I think you're definitely on a good track. to helping people kind of understand some of the things that
Yes.
could be worked through with a chamber.
Right.
Obviously, we're going to discuss the different types of chambers and the different protocols
Sure.
within that.
Sure.
However,
Yeah.
you just reminded me of one of the first reasons why I even got into the world of hyperbaric therapy, because my dad, who was morbidly obese,
Yes.
I know you and I talked about this.
We did.
His
leg, right?
He passed away December of last year. It'll be a year this December. However, one of the things before he even got into the hospital, which I think exacerbated all of his issues, before he even got into the hospital, he was dealing with those diabetic, I guess you would call them ulcers or wounds.
Ulcers on his legs and his feet. Yep.
Yes. And that, as we know, as most people know, that's a lack of circulation. And sometimes, you can do the red light on it. You can do all the different creams and things like that. But one of the things you had mentioned to me was like, maybe we should look at getting him into a hyperbaric chamber.
Right.
And we did that, right? We looked at doing it, but because he was so big,
too big. Yeah.
he would have had to have like a special chamber. And we found all of that stuff, but the protocol that they were going to prescribe for him was not going to be covered by insurance.
Yeah.
And it was going to
be
cost
expensive. Yeah.
about $30,000.
Yeah.
So that's when I came to you and was like, well, if we're going to be even halfway considering that, which we didn't have the money to do it, but if we're considering that, then what are the options for getting one at home so that we could use it ongoing instead of just, a treatment,
Right.
a handful of sessions. So I wanted to mention that because there
Right.
might be people out there who are in that position.
Yeah, I mean, it's a big deal, right? Diabetes it's a challenging disease, and it really kind of ruins the microcirculation in the legs, and you can get these ulcers, and the ulcers can get infected, and the infections can cause amputations over time. So, I mean, I saw many patients that had previous amputations when I was first starting practice in like 2013, 14, and they'd come to see us after already having one or two amputations, trying to save a limb or a digit or something like that. And sometimes we were successful. And then they'd often say, well, why wasn't I referred before I had my first amputation or something like that? So but it's not for the faint of heart. It's definitely a challenging protocol to do. There's different types of hyperbaric therapy. There's different chambers, there's different pressures, and there's different lengths of protocols. But the more severe the issue, the more long-term the issue, the more hyperbaric sessions you need to see the benefit. And then the deeper, the more systemic the issue, the deeper the pressure you need to get enough oxygen tension into the wound to help it heal, right? So the brain and the spinal cord are less sensitive to oxygen, more sensitive to oxygen, so they need less oxygen to see the benefit, as opposed to like a toe, which you need more oxygen to get to those areas to see the benefit of oxygen tension. So there's a lot of variability there overall, but I mean, I think the quick and dirty on hyperbaric therapy, for those who haven't listened, is just that it's an increased atmospheric pressure compared with increased inspired oxygen. So typically we're at sea level and we're breathing 21% oxygen. That's considered what we call, 1 ATA, or like sort of normal sea level pressure. And what we do in the chamber is we increase the amount of pressure to a certain amount, whatever we decide. It could be 15 feet, 30 feet, 45 feet, depending on the indication. And then we increase the amount of inspired oxygen that you breathe. The combination drives a lot more oxygen in circulation. At about 33 feet of seawater, you get about 2,000% more oxygen in circulation. So it's a significant amount. And most of the oxygen is carried on red blood cells, but in a chamber, you're actually saturating the plasma or the liquid of your bloodstream as well. So you're getting a lot more oxygen carrying capacity. So it's the beautiful thing about it is that when you have more oxygen circulation, you can heal better, you can recover better, you can accelerate the process of really almost anything. I often say that hyperbaric therapy is a massive synergizer, accelerator, and a recovery technology. But oftentimes, if it's a chronic issue, it's not just about getting into the chamber, and that's the tricky part, right? Where if you have an acute issue, if you have an acute trauma, acute infection, acute injury, hyperbaric therapy is fantastic. It's just really just revving up the whole system, make you heal faster. However, if you have a more chronic issue, if you have a long-term problem, like say you have chronic fatigue or long COVID, or you have a chronic injury, like it's going to take longer to heal. And so you need more hyperbaric therapy and more modalities around hyperbaric therapy to see the benefit.
So there's going to be a couple of things that I want to sort of position myself as the lay person who doesn't understand some of these things, because as we know, there's enough misinformation and malinformation on the interwebs for people to kind of go, you know what, it's too complicated, I don't want to talk about it. So I would love to try to simplify this a little bit, because when you mentioned the sea level and getting more oxygen, I think the average person might think, well, isn't there less oxygen, the lower you go in the water? Can you kind of touch on that, or maybe figure out a way to kind of simplify this for the layperson?
Yeah, no problem. Easy thing to think of is go to Mount Everest, right? Can you breathe? The answer is no, you can't, right? Because the air is very thin up there. There's actually less oxygen in the air at Mount Everest. That's why people need oxygen. That's why people die up there, because there's less oxygen. Okay. Another good example is when you're on an airplane. An airplane, you're pressurized to about 8,000 feet when you're in a regular cabin on your regular airline. Sometimes the Dreamliners will be 6,000 feet, but when you're at altitude, higher in altitude, you have less oxygen in the air because the air is basically thinner. It's less dense. Now, if you go to the opposite location, the deepest place with that you're not under the water, that would be the Dead Sea. So the Dead Sea in Israel or Jordan, wherever you kind of get it from, the Dead Sea is about 1,000 feet below sea level. So as a result, the air is denser down there. And as a result, the oxygen levels are higher. So if anybody's been to the Dead Sea or knows about the Dead Sea has been known for thousands of years to be a healing place. Now, the mud's pretty cool. You can definitely lather yourself in the Dead Sea mud and the salt and all that, but they also have good studies on pulmonary disease and cardiac disease and things like that. So what you're doing when you go underneath the water is you're increasing pressure. Water is extremely heavy. Okay. Water is, Josh is pretty strong. Maybe a bucket of water is not that heavy for him, but for me, I'm like, my goodness, I can't do this. I need to have bigger muscles. And so, water is heavy, right? That heaviness is pressure. So the density of water is like massive amounts of air, basically. It's like, it doesn't even compare. So you have 15 feet of water or 30 feet of water, you're having significant amount of pressure on your body and your lungs specifically. So you don't feel it when you're underneath the water, but you know that water is extremely heavy. And so it's that heaviness that you simulate in the chamber. And as a result of that, it's that heaviness that is increased atmospheric pressure that drives oxygen in circulation by some physics laws that allows you to get more oxygen in circulation that way.
I'm so happy that you went through that, because obviously I know enough about this because we've talked a lot about it before, and I've done some research around it just to make sure that I know what I'm doing. But I never really considered the Dead Sea, the 1,000 feet below sea level being a reason or a contributing factor to some of the benefits, because we always think about the salt, right? The salt water, which is obviously very helpful and very full of electrolytes and minerals and
very
all the
buoyant.
things that we need, right?
Yes, you can
very
hang out in the water.
buoyant,
Yes.
And then we also hear about the mud, mostly because of that as well. But I never really considered the oxygen capacity at that level, just maybe just standing in the water or just maybe walking around the beach there.
Yeah, exactly. So this is a big deal because it's really just about the density of the air. The density of the air gets increased. It increases the deeper you go. So the further down below sea level you go, where you can still breathe, the density is going to get higher, right? The density of the air, how close the molecules are together, is much, much less when you're at Mount Everest or on an airplane. So you have just less oxygen per volume of air to breathe. So it's a volume thing. And so when you're going in a hyperbaric chamber, for example, right? So you have like a 1.5 atmosphere chamber at your house, just, from one base, like you're going to have, even if you didn't breathe extra oxygen there, the density of the air is going to go up, okay? Because the oxygen molecules get closer together. And as a result of that, you get more oxygen in circulation, even if you're not adding extra oxygen. Actually, just about 60% more oxygen in your bloodstream just by breathing the air inside of a hyperbaric chamber at 1.5 atmospheres, which is about 23 feet of seawater, something like that.
Interesting. Yeah. This is fascinating because I'm going to personally geek out, and I hope that the person that is watching and listening to this also gets an opportunity to geek out. And if you have questions, those that are listening and following, if you do have questions that I don't ask and you would like Scott to address, just, write us a note so that we can follow up on this. But that's one of the things I also wanted to touch on, is because, and we will get into the difference between the soft chambers and the hard chambers, of course, but there's always this question of, do you need to wear the cannula or the mask to get that oxygen. And I think you just touched on that, but maybe you can go a little bit deeper as to maybe why it might be beneficial to wear it or not wear it.
Yeah, I mean, look, so you are getting more oxygen in circulation without the cannula or without the mask. But when it comes to healing in general, especially more acute stuff, or at least your initial protocols, I usually recommend using the cannula or the mask is actually better because you're going to get more oxygen in by a minute-to-minute basis. So if you have a 10 liter per minute oxygen concentrator, which are pretty common, that's the rate that oxygen's going in, and you have that going into a chamber at 1.5 atmospheres while you're at full pressure, instead of getting 60% more oxygen in circulation, you're getting like somewhere around 400 to 600% more oxygen. So it goes up, pretty dramatically with extra oxygen overall. So, and when you're looking at healing, what are the major reasons why people don't heal? Well, the one major reason is that they don't have enough oxygen getting to the tissue. And why is oxygen so important? I think everybody kind of knows this, right? Oxygen is really important for us to be able to make energy in our cells. And if we have injuries, if we have inflammation, if we have swelling, it can sometimes be very difficult to get enough oxygen to that tissue. And so what hyperbaric therapy can do, along with the pressure component, of course, is it can drive more oxygen outside of that blood vessel further that it's getting into, and then get further into that tissue bed where there may be injury or lack of oxygen. I mean, this is why there's some really good studies actually on acute heart attacks, strokes, traumatic brain injuries, limb amputations, partial limb amputations. I saw a couple of those when I was in medical school. Like you can see how hyperbaric therapy can be used in those acute settings to reverse or significantly mitigate that damage. Now, I don't want anybody to get the wrong idea. If you're having a stroke or you have a concussion, like go to the hospital, right, and get checked. There have been some crazy hyperbaric doctors that I've known that have put themselves in hyperbaric chambers when they're having a stroke, and they've recovered. But I don't recommend most people do that. But after you get better, after you get stabilized, one of the best things you can do is get reoxygenated as fast as possible. But just a little side note here, Josh, is that on the transcription side with methylene blue, I always have all of my patients have a high strength methylene blue at their house. It's our Tro Plus blue, because methylene blue can act just like oxygen in our cells. And so it can potentially mitigate some of the damage of having like a low oxygen state. So acute infection, acute trauma, acute ischemia, all my patients have that. And so I have this whole protocol, and we'll get into those kinds of things later, I'm sure. But the idea is like having people ready for anything, right? Like if it's going to be an acute issue, or if they're going to go traveling, and having things that they can do like hyperbaric therapy, methylene blue, whatever, and then being ready for, things that you don't want to happen, of course. But just to give you a sense, like there are things you can do on the acute side that would not, prevent you from going to the hospital, like taking methylene blue. But certainly the hyperbaric chambers can be great as a post injury or post event recovery, because you're increasing more oxygen circulation. And when you do that, you're making more energy, and you're also creating the whole process of revving up the system's capacity to heal. And I can go through all the major things if it would be easier for what hyperbaric therapy does, if you'd like as well.
Yeah, I mean, I think the way you broke it down is pretty great, and I think most people nowadays we're getting savvy as a global consumer, right? We're getting a little bit more savvy. So I think it's obvious now for more people to understand that the like most disease states in our body mostly occur in a state of a lack of oxygen or anaerobic sort of environment, acidic environment. And so anytime we can boost our oxygen carrying capacity, then chances are we have a better opportunity to heal, right? Or to recover from said issue. And I've understood that for a long time.
Right.
And I think that's why some people have the question of, well, couldn't I just take in more oxygen? Because I used to have one of those EWOT.
Cannulas.
Yeah, like the EWOT device.
Yeah. Okay. Sure. Yeah.
And the EWOT, for people who don't know, is exercise with oxygen therapy, right? And that's basically getting on a bike or a treadmill or assault bike, having this big bag of oxygen that's being concentrated into a closer to 100% oxygen, and then you take that in, and the hope is that you've built up enough CO2 to be able to then carry this new oxygen that's coming in. And it works, but can you explain the difference between a chamber, both a soft chamber and a hard chamber? Because it might not be just as simple as difference in depth, right? Can you talk about that?
Yeah. Real quick, there is that the big deal is pressure. Okay. What people don't realize and gets sort of left on the wayside a little bit is that if you don't have pressure in a hyperbaric environment, there's really no way to increase the amount of oxygen carrying capacity very much. You can do it a little bit, you can't do it a lot. And so the pressure is what changes the physiology and drives oxygen in circulation. So as I was briefly mentioning earlier, red blood cells typically carry oxygen. Like red blood cells are your oxygen carrying capacity. So depending on how many you have, that's how much oxygen carrying capacity you have. Now, in a hyperbaric chamber, you can actually not only saturate your red blood cells, but most of us have about 96% of those sites saturated already after you come and you breathe normal air, because if you take a pulse ox on your finger, everybody knows now what those are. Typically, it's going to measure around 96 to 100% for the average person. Okay. And so that means all the sites that are bound by oxygen on those red blood cells. Okay. So there's not a whole lot more you can do, maybe like 3, 4, or 5%, something like that, not a huge amount. But if you have pressure, then you can drive 12 times more oxygen into the circulation of the blood by actually diffusing it directly as liquid O2 in the bloodstream. And that liquid O2 doesn't have the same physiologic parameters, meaning it doesn't have the same limitations actually as what red blood cell oxygen has. To get actually red blood cell oxygen into your tissue, you have to have all these sort of local factors to help you do that. We have all this reserve on our red blood cells if, for example, we get into an extreme event, or we have to, we decide we want to run it like a long marathon, we have a lot more oxygen available to us that we don't use on a regular basis, right? But it's harder for us to unlock or to take that oxygen off except under significant conditions. Mm-hmm. Whereas in a hyperbaric chamber, you can do that without having to do any work at all because it's liquid O2 and you have that pressure that's helping out. I know that's kind of a complicated scenario, but I think
interesting.
But the short story and just the correlation here with CO2 is that you don't want to hyperventilate in the chamber either, right? And this is actually really important because if you're hyperventilating, you're breathing too fast, then you're preventing that oxygen on your red blood cells from getting off your red blood cells and actually going into tissue. This is actually not even just in a chamber, okay, everybody? This is actually, if you're hyperventilating, breathing too fast now, you are likely not getting enough oxygen to your tissues because you are not allowing that physiologic change to happen in your tissues because you're binding too much of that oxygen on your red blood cells. So just as a plug to start breathing slower and having periods of time when you take time to rest and relax is really important because most of us are hyperventilating all the time, especially when we're doing podcasts. But that's that's the nature of it.
Well, yeah. And anytime we talk, right? Like we're not able to breathe optimally. So sometimes I need to shut up.
All of us, yeah. I have all my patients. I have them do a walk every day if possible, 30 to 45 minutes, nasal breathing, because that's the best way to increase nitric oxide, to increase blood vasodilation, heart health. People start losing weight very quickly that way. But the big thing is, to shut up.
So just to put a cap on what you just talked about and that question I asked, and I think you addressed it, but it sounds like the difference between soft chamber and hard chamber is the amount of pressure that you can get, right?
Right.
Go
Typically,
much deeper pressure or much higher pressure with it's kind of inverse relationship, right? Higher pressure, lower atmosphere, right?
Yeah, I always just say mild hyperbaric therapy and deep hyperbaric therapy, or I can say low amounts of pressure and high amounts of pressure, but that's get confusing to people because they're like, so I usually say like, you're in a mild unit, you're in a deep unit, you're going to mild pressure, going to deep pressure. So that's pretty helpful. And so depending on how deep you go, the deeper you go in a hyperbaric chamber, the more pressure and the more oxygen you can get into circulation. Now, the opposite is also true, right? So if you're in a hypobaric environment, you're in a plane, the higher you go, the less oxygen you're going to get in circulation because you're going to have less oxygen around to do that. So this is why being on an airplane or being on Mount Everest, for example, is going to give you less oxygen and you're going to get all the sort of downstream effects of being low oxygen. And this could be things like more inflammation. It could be more like if you're on an airplane, more ionizing radiation and more subject to infection as well. So not to say that hypoxia is always a bad thing, actually. I think that there are roles for hypoxia, interestingly enough. So, but it's just a different physiologic mechanism. And I think used for different reasons overall.
Okay. This is super helpful. And I want to get into the part of the conversation in which you get a chance to tell me off, tell me if I'm doing something right or not. Because one of the things I love about you is that you're quite open to, some of the things that I might deem crazy. You said it at the beginning, your dad was the crazy doctor. And so,
Right.
You had your
nothing's off limits for the most part is what
Right.
I just try to be careful what's physiologically plausible, what's potentially unsafe. And we can go into some of the things you're doing. And I know we discussed it. I'm all good with what you've been doing, but I just one other piece on the EWOT that I should mention is that I think there is a role for EWOT as well.
Mhm.
I do think that there is a way to deliver more oxygen with increased cardiac workload overall. So I do think that it can be helpful for some people. And I do have patients that use both as well. So, but it's not a different physiologic, it's a different physiologic mechanism. So it comes down to.
Yeah. I think like for the person out there who is maybe not familiar with it, I think you can see some really interesting benefits from using EWOT.
Yeah.
And then as you dive more into the research and you get comfortable doing it, you start to see like, oh, you know what? I could probably do more with this, right? There's more I can do with this system that is our body and our brain. One of the things that I wanted to get your feedback on, now that I have a chamber here, plus all the other toys that I have, what I was trying to do, and let me know what you think about this, but I have been using, so you might be familiar with Anders Olsen of Conscious Breathing. Are you familiar with him?
Yes.
Yeah, he was featured in the book Breath by James Nestor.
Right.
And he has like he came up with this breathing tool called the Relaxator, which I love using to kind of help with creating pressure in the lungs and
that's a whistle, or is that something else?
Yeah, it's like a whistle that has you can
you showed me this. Yeah.
Moderate the
I gave it to one of my daughters. Yeah.
Yeah, there you go.
You gave me one. You gave me one a while back. Yeah.
That's right. Yeah. So he also has a really cool product called the Carbogen, I think it's called. Basically it's a device that utilizes carbon dioxide. So it increases the level of carbon dioxide and use that to then do the opposite of what we're talking about here with hyperbaric, increasing the pressure. And the whole hope or the idea around that is to increase the capacity of the red blood cells to be able to carry oxygen. So what I was doing for a while, I'm happy to stop doing it or continue doing it, is I would do one of those sessions before getting in the hyperbaric chamber. And then when I get out of the hyperbaric chamber, not right away, but at some point after getting out of the chamber, I would do molecular hydrogen inhalation. What are your thoughts on that?
Well, as always, you're getting very fancy, Josh, and that's cool. There are some people in the world of hyperbaric therapy that are playing around with carbogen or carbon dioxide, right? So what carbon dioxide will do, as your carbon dioxide levels increase, it does cause vasodilation. It does cause the dilation of brain vessels, blood vessels, et cetera, that are going to carry oxygen. So it's something you have to work on slowly overall, because people can get very off kilter. They cannot feel very good when they actually inhale carbonic anhydride gas, because it's going to increase your CO2 levels. It's going to shift your physiology, can make you feel dizzy and lightheaded. I remember the first time I did it, it was in this HOCAD chamber, and it just made me feel terrible. I mean, but they put me on like the highest setting, and I'd never been in one before, and I felt like I was going to die. But there is what you're really getting into here is kind of like my framework of how I think about hyperbaric therapy, which is, what are you doing before, during, and after to truly, modulate the therapy itself, hyperbaric therapy, to make it work better? And, or how can you make hyperbaric therapy work better for the other things that you're trying to do? So you can look at it in both directions. And one of the things I think about a decent amount pre-hyperbaric therapy is vasodilation, because one thing that can happen the deeper that you go into a hyperbaric chamber is that you're going to cause actually more vasoconstriction of your blood vessels. And
because of the pressure?
Because of the pressure itself, and because of the oxygen. Actually, there's a couple different physiologic mechanisms that are ongoing here. But overall, you're causing a vasoconstriction of blood vessels. Now, that might sound bad, but in general, not a bad thing, because you have so much more oxygen in circulation that you're delivering more oxygen despite the vasodilation. And if you have the vasoconstriction, if you have a vasoconstriction and you have a blood vessel that's injured, this is a good thing, right? Because if a vein or an artery is injured, okay, and you have it spilling out liquid or whatever else, blood into tissue, it's going to cause inflammation. It's going to cause hypoxia. It's going to cause a whole downstream effect of nastiness, right? So if you can constrict the blood vessel in the short term, like an acute issue, that could be a very good thing. Okay, especially if we can imagine like in your brain, you just had a brain injury, right? And you're having blood vessels that are leaking stuff and causing swelling. There was a study that looked at this actually in hyperbaric therapy, just 3 hyperbaric sessions for an acute severe traumatic brain injury decreased mortality by 50%. And this is because of the decrease in swelling in the brain. So saying all that, vasodilation for more chronic issues is actually a better thing, right? So if you can stimulate those blood vessels to not constrict as much, you can usually see a bigger benefit faster in people. So I don't usually play with carbonic anhydrase gas. I usually don't play around with carbogen. But what I do play around with other vasodilatory kinds of things because it's a little bit safer overall. Although if you're very healthy, I think you can play around with carbogen just a little bit and see how you feel. Because what that's going to do is it's going to stimulate more oxygen to flow into tissues where you've dilated blood vessels, right? So like I'll often use like a good example that's very safe is something like low-level light therapy, like near-infrared therapy. So that's, red light therapy is going to dilate blood vessels and it's going to start enhancing energy production wherever you've stimulated the light. And so that light stimulation is now going to allow more oxygen to go to those areas wherever you just, had the light shining. You can also bring red light into chambers too, like certain milder units. You can bring in portable lights and use it that way. You can do it on your face if you want to do it on your face and get more collagen and all those kinds of things, or heal something, or you can do it on your shoulder or your knee or wherever else, right? If you have a portable unit. So the vasodilation part is a couple of there's lots of different ways to do this. And I'm sure you can think of many off the top of your head right now, as I know you, Josh. But one of the main ways I do it is with lights. Another way that I'll do it is giving something like a nitric oxide booster. So if you can use something like one of the nitric oxide supplements, they can use beetroot. There's also a number of companies that make it. I've been testing one from one company now that's a practitioner only line called Calroy, but there's also N101. There's Berkeley Life.
N101,
yeah. Those are some companies that make them, and so I use those before the chamber myself, and then I'll have other my patients use that as well. So you can use that increases vasodilation at the same time. So the short answer to your question is that that carbonic anhydrase gas, CO2, can be something that can be used to increase vasodilation. Actually, I have people that are using it before the chamber. I have people that are using it inside the chamber. Now, I don't recommend that because that's a little weird, just because, again, you have this mix of extra oxygen with extra CO2. And if you don't have like a really good set point in physiology, you could maybe like make yourself feel not very good in there. Yeah. So I don't recommend that typically. But I do think that there is a role, especially for the vasodilatory kinds of things before you go into the chamber, if you have more of a chronic issue or even a short-term issue that doesn't require vasoconstriction is what it comes down to.
So thank you for pointing that out, because you gave me another idea that I was doing when I wasn't doing the carbon dioxide therapy ahead of the chamber, and that is blood flow restriction or blood flow moderation with the Katsu bands.
Yes, so for sure.
That's one of the things that I do more than I do the carbon dioxide therapy.
Yeah, although I just be careful there because part of the vasoconstriction related to blood flow restriction is to create that hypoxic stimulus in your muscle tissue. So you may not want to go, if you're looking for muscle hypertrophy, for example, there's a possibility if you go in too soon after doing that, you may mitigate some of the hypoxic response that you're looking for with blood flow restriction. Yes. You could potentially do it the other way around, where you can do it after hyperbaric therapy, because you'll get to a point where you actually get to hypoxia later, because it'll take you longer to get to a hypoxic stimulus after you get into the chamber. So just for people that are listening, once you're in a hyperbaric chamber and you get out, you have about 30 minutes or so where there's going to be more oxygen in circulation, okay? Because you have all that oxygen in plasma. So you can leverage that oxygen. And so I have a lot of people, Josh knows this with some of his athletes and clients, like you can utilize that post-hyperbaric period to do more work. Like you can go immediately exercise or go lift heavier weights or do some sort of endurance work. And then you can add a bunch of other things. I'll add on methylene blue to increase the time that you have oxygen or some oxygen carrying capacity. But, to keep it not as complicated in general, you can use that post-hyperbaric period to do some extra work because more oxygen carrying capacity is available to you for longer, right? So that kind of thing. Yeah.
No, that's, again, beautiful that you pointed that out, because a couple things happened to me, and maybe this will be helpful for the person who's watching and listening, and maybe they experience something similar. Maybe you can touch on this, but
Yeah.
a couple things happen inside the chamber, and I have the one base set up thanks to you,
Yeah.
and you've been helping me, and the company is very helpful with all the protocols, and you can attach it to your phone, and you have these app and all it's very, very cool. So one of the things that I like more than anything is that I can use this by myself. It's got 3 layers of zips.
Yep.
Very self-explanatory. Flip the thing on, turn on this, turn on that. Everything's rocking and rolling. Put on your cannula or your mask, zip it up. It's good. It's safe. It works. The other thing that I like with this setup compared to some of the other setups is that it has the air cooling feature. It cools the air on the inside. And for me, that's a big deal because almost every single time I use the hyperbaric chamber, I sweat. And so I'm curious, is that because I got more circulation? Is that common? And then after I go through that sweat and I start to normalize and I cool off, I always fall asleep. Can you touch on that?
That's interesting. I think there's some physics going on there, right? So as you're going deeper in pressure, there is a physics law that there's a inverse relationship between pressure and temperature. So you'll have, as you increase in pressure, you actually, no, I think it's actually not inverse. It's directly correlated. So increasing in pressure will increase the temperature overall. And then decreasing the pressure is going to decrease your temperature. So typically, you go down in pressure, you get hot. And when you go mild in pressure, you come out of pressure, you get colder. So people feel colder as they're coming up out of pressure, that kind of thing. So as far as your reason for, getting hot and then getting tired, this actually goes back to what you were discussing earlier with the breath device, actually. So the main thing that we want people to feel in the chamber is that's a healing environment, right? And so do we heal in fight or flight or sympathetic mode, or do we heal in parasympathetic mode? We heal when we're parasympathetic, right? We heal when we're relaxed. And so doing the breathing kind of exercise as you were doing is going to help you become more parasympathetic faster, right? Yeah. And so typically when people first go into the chamber, they get a little bit of a sympathetic response. That's usually because of the pressure, the temperature, you get hotter, those kinds of things. So all that might be a mild sympathetic release for you. And then after you kind of get to pressure and you kind of get situated, then you go I'm sure you specifically go very quickly into parasympathetic mode. Yeah. And that's when you're going to get tired, right? And that's okay. The hyperbaric environment is supposed to be a healing environment. And so sometimes I'll do work in there. Sometimes I've even recorded a podcast in there, which was, just kind of like a hokey thing I did once. But in general, I like to relax in there, right? Because that's what we need to do. Most of us are just on all the time. And I like to remind people that we could certainly do those things sometimes in the chamber, especially if you have one at the house. But if you're using it for a specific recovery reason, you want to recover in parasympathetic, right? So I also work very hard with people, and I'm actually just testing some new tools now, how we can get people more parasympathetic faster in the chamber so they get that healing as soon as possible, when they get in there. Especially when they first start, when you're first getting into a chamber, it's a new experience. You talked about the zips and you talked about the on and the off and the
move
oxygen.
It around.
Yeah. What we did at One Base, I've tried to do is create protocols for people so that there's integration. So you know what kind of do it before, during, and after. We have an app there that helps you. And, we're coming out with this really awesome, in a couple months, this new Bluetooth technology. So you'll have all these ability to monitor all your stats on your phone, which is going to be fantastic. Turning your chamber on and off, monitoring with sensors. And then we have all these sort of wearable integrations that we're working on. It's it is going to be nothing. There's nothing like it ever or so far on the market, which I'm really excited about. But I still want to get people to relax as much as possible in there. Yeah. And that's the key. I think that's really what's going on with you. So we talked about the pre-hyperbaric stuff. The pre-hyperbaric stuff for me oftentimes is how we can get somebody so that they can get as relaxed as possible when they first, get into the chamber and start going to pressure.
Well, I can tell you one thing that I have found that works a little bit, right? Is I'm sure you're familiar with the Palmer technique, right? The globular skin, the skin of the tissue of the hands and the forehead, and I think one other place on the body is a really good indicator of your body temperature, your core temperature.
Sure.
And they had, I think they made this Palmer cooling device where you put your
Yes,
hand
I
in,
know it.
right?
Yeah.
So
Yeah.
there's a few companies that came out with let me turn this off. Somebody's trying to get me on a call. There's a few companies that came out since that. They came out with these different devices that are different than the mitt, right? The cool mitt. Cool mitt was like one of the first ones.
I know
I
that
think.
one. Yeah.
Yeah. So I have these tubes that have this electrolyte solution inside that you just leave in the refrigerator, and they look like almost like straight dumbbells that have caps on the end of it. You just put, the liquid inside, and then, you take it out. And I use that for recovery from exercise. So like if I'm doing a workout here in the front room, then I'll go grab that, hold it for, 10, 20 seconds or whatever. And then I go back doing exercises. What I've started to do now is I take those into the chamber with me
Interesting.
to start. And I was doing it mostly as a cooling mechanism, just to cool my core temperature. But I think what that's doing is doing what you're saying, which is getting me closer to that parasympathetic response, which makes sense. It really makes sense. And, I think this is why it's nice to have people like yourself and to have the team at One Base, so we can bounce these ideas off of each other. Because if you've got this unit, if you've already invested in it, then you already know that it's helpful. And regardless if you're using it to, as a prophylactic, or you're using it to recover from exercise, or you're using it for the very serious things, the fact that you have it, you may as well get the most out of it, right?
Absolutely. Yeah.
So, yeah.
That's the key, really. And then that's what I tell people all the time. It's like, look, this is a device that you can use over a long period of time. We have different types of protocols that you can use for all these different kinds of things that might pop up from a wellness perspective, from an injury perspective, from a prophylactic perspective, and also for your family. Like I have one at my house. I have 4 kids, and I have one of my daughters that plays soccer, and she's a defender and a halfback, and she's not that big, and she's tough, but she gets knocked around. And so, I give her methylene blue. We get into the hyperbaric chamber on a pretty regular basis overall. And I started using one of our other products I was mentioning before called Tromune, which is kind of this immune system support as well. That's a neuroinflammatory modulator, so it decreases brain inflammation. And so, like, it's great to have like one tool, right? Like, but I think that's where I kind of differ from most people in the world of hyperbaric therapy, is that I think of it as this sort of integrated tool, right? Where how are you going to use it in this, again, as I described this framework, what are you doing before? What are you doing, inside the chamber? What are you doing after to, truly leverage the technology, right? And so you using, the cool hand things, it makes a lot of sense to me. And, what I'll often do is that I will make sure that when I'm talking to people, that we're looking at all these various ways of getting people more parasympathetic before they get in, that we're increasing the ability for them to make energy in the chamber too. So, that's that you're showing the Tromune, which is awesome, which is fantastic it's an antimicrobial. It's something you take at night. It's an anti-inflammatory. It's high strength cordycepin, which is a cordyceps mushroom extract. And most people know the cordyceps mushroom has been around for thousands of years. And I've been so impressed with this particular compound. It's been now studied in things like inflammation, infection. They're doing studies with it in cancer and allergies. And so I use it in my kids all the time. I use it for me when I travel, and I use a lot of pre-hyperbaric therapy. I use a lot of methylene blue as well. And I know you do this as well, because methylene blue helps with energy capacity. It increases oxygen. It increases the ability to make energy because it acts just like oxygen. So I'm always thinking about how are you doing these things in combination, right? So, hyperbaric therapy by itself, I will say, for an acute issue, can do amazing work, even if you don't do anything else. Okay. So if you have an acute issue, but once you have more of a chronic thing, especially, it's really important to think about the framework of it all.
Yeah. And what I have up here now, so for those that are watching this show, you may have noticed that I've pulled up the website, which is Troscriptions.com. And I'll probably pull up the One Base website as well. But
yeah, please.
For now, what I have on the page here is the Trosee, which is it's new to me, and I think it's fairly new to you guys' lineup of products. And I got a great opportunity to try this out before it became available.
Right.
And then I've been using it, and in fact, I let a couple of my clients have my stash, and And I was like, oh, I'll just go on the website and order some more. And then I went and saw that it was out of stock because
We're
you
back
guys
now.
sold-
We're back
yeah,
now. We're
but
good.
you are
Yeah,
back
yeah.
now, so I do
Yeah,
have
yeah.
mine. So I'm holding it up here. But I'd like to talk about the Trosee because one of the things I love about doing my hyperbaric chamber sessions is that I almost am guaranteed that I'm going to take a nap.
Yeah.
So I call it like I literally call it my supercharged nap.
Yeah.
So if somebody's messaging me in the middle of the day, like someone was just messaging me now, I usually tell them, hey, I'm doing my supercharged nap. I'll, talk to you later. And
Yeah.
they're always like, what is that? I'll go, I'll explain later. So for those who've always wondered, what is this supercharged nap? Let's talk to them about it. So I either use Trosee or Tromune, right? Always use methylene blue. I always do, right? And I know that you guys have on the website, you can stack some of these.
For sure.
These compounds. But let's talk about what is Trosee and maybe the difference between this and any other like sleep aid.
Yeah. So, I mean, if you're taking a nap like during the day, like you want to have as sort of efficient napping as possible, right? And so the nice thing about being oxygen infused, especially if you can get more parasympathetic faster, then you're going to get deeper sleep and you get more oxygenation, more recovery. Like most of us have felt this, right? So if, like as a kid, I remember this is, I didn't nap very much. Most of us don't nap very much as a kid, but you can, like, if you have a really good sleep after studying, like you can actually sort of consolidate that information better. And naps are kind of the same way. We can help kind of consolidate our information better. So in a chamber, you can take a 30 or 60 minute nap and you could feel fantastic afterwards. So I'll often do that when I can in the middle of the day. But what some other people will do is use hyperbaric therapy sort of at the end of their day and when they're kind of like winding down for the evening. And that's a great time to use what I would use either Tromune or Trosee before going in the chamber, because that's going to help you relax very quickly. You're going to be able to take like a little bit of a nap in the chamber, and then you can go out of the chamber, do your evening routine and then get to bed, that kind of thing. So
Smart.
I'll definitely do that too. Yeah, because Trosee is pretty long acting. So it's something that you want to do, and usually in the evenings. It has a long acting ingredient in there from one of your favorite mushrooms, Josh, the Amanita muscaria mushroom.
Mm-hmm.
It has the non-psychedelic ingredient called agarin or muscimol. And that's working on the GABA system, which is a neurotransmitter system that helps us relax, right? So it's about 6.5 hours of activity. So if you're going to take it, you want to make sure you have at least about 6.5 hours to sleep overall. One thing I should mention, I usually don't recommend sleeping in a hyperbaric chamber. Like some people, I'll say, well, I just want to sleep in there all night. It's typically not a great idea to do because it's just too much oxygen exposure for too long period of time.
Yeah.
And typically you want to go in there for maybe 30, 60 minutes, maybe up to 2 hours at some points, but that's kind of like your max overall. So,
and I think it's the timer, at least on my unit, only goes to 120 anyway.
Right.
Which is
We
2
only
hours.
allow 2 hours in the chamber for that reason. Yeah. So that's kind of your max overall. So you'll hear about like certain football players or athletes that are sleeping in chambers. I don't usually recommend that. If you're doing it very rarely, it's probably okay, but certainly on a regular basis, you don't want to be doing that overall. So in the mix here, if you're doing a nap during the day, the chamber is fantastic for that. I actually use our, for naps, I use Trocom actually, because, Trocom is actually a little bit more short acting. And so I'll do that before I go into a chamber. I'll typically, my stack would be, I take some Trocom, I eat, and then about 30 minutes later, I go into the chamber. And then that's usually a pretty good stack for me. And then I get like about 30 to 45 minutes in the chamber. I take a nap, and then, I'm good for the rest of the day for hours and hours and hours. So what I like about Trocom specifically is that it doesn't make you tired. Some things that you take, especially if they're anti-anxiousness, anxiety drugs or supplements, they can make you feel tired. So I use this one during the day if I'm feeling like I just need to kind of like wind down and just take the stress level off a little bit. And then in the evenings, I'll use Trosee and Tromune typically, depending on my protocol.
That's a great outlook on that. And I think I'm going to follow suit because it makes sense.
Yeah.
And I do like the idea of that. I probably should get myself some more of the Trocom because I usually was using Trocom on days that I fly.
Yeah, that's common. Yeah.
I know we had talked about this back in the day. We were trying to find out some ways to do some content around Trocom. And I tried to identify throughout my day, like, when am I ever anxious or depressed or whatever? I was like, yeah, I don't really think of anything. And then around the same time we were talking about it, I was going to go get on a flight. And I'm like, no, 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 no. This is when I get
Yeah.
anxious, is whenever I have to deal with these freaking like, TSA and baggage claim and all this stuff.
Yep.
So that's when I typically use it.
Yeah.
But I think you've encouraged me now to kind of rethink maybe I should also kind of use it for my naps or my, relaxing through the day.
Yeah. What I also would say is that we do have some people that are microdosing like a quarter of the Trosee and like a quarter of the Troimmune as throughout the day, because for various different reasons. So Trosee's got, mild amounts of things that should enhance sleep, but at very, very low doses, if you're doing other things that are not sleep inducing, it should be okay overall. And then Troimmune is very interesting because Troimmune it works on this system called the adenosine system in the brain and the body. And adenosine is something that induces sleep, but also it can induce energy production as well, because adenosine is part of making ATP, like the energy currency of our cells. So what people have been doing is been using low doses of Troimmune with caffeine, because what caffeine does is it blocks the receptors that bind adenosine in the brain. So if adenosine binds to the receptors, you feel sleepy, but if it blocks those receptors, you don't. And then that adenosine is going to get diverted into helping with performance overall. So we have people that are using Troimmune with caffeine, or even our blue carnitine actually in combination, and then going to do workouts and seeing pretty significant benefits. So there's all these nuances of these things, but in general, for short acting relaxation, Trocom is typically the way to go, because it won't make you feel tired. For more long acting relaxation and help with sleep, that's usually Trosee. Troimmune is an anti-inflammatory immune system modulator, typically given at night, but you can take very low doses in the morning with caffeine and see significant benefit there. So again, all these things in sort of the ecosystem of there's lots of different options for people, I think, but what it comes down to is you got to think about, what do you need the most help with? Do you need the most help with relaxation? And during the day, do you need the most help kind of winding down at night? Is your immune system kind of trashed and you're always getting sick? Are you just feeling like you're just tired all the time and you just maybe need some extra oxygen to kind of go along with all that, right? So I think what it comes down to for me, at least in my clinical practice, Josh, is that the oxygen is sort of like that almost that base for people, is that we need to give people more oxygen, more energy capacity, and then support them along the way.
So then as we start wrapping up, because I think, we've obviously belabored this quite a bit. And if people can't tell by now, you obviously know a lot, and we've only scratched the surface here. So I will encourage people to come back to this and let us know if you have any other questions that we maybe hit or didn't hit, or maybe you want us to go a little bit deeper on some of these topics, because the thing about this is once you get into the realm of utilizing this, then you might do what I've done, which is created like a recovery room in my apartment. And then I have a workout room. And then I have all these things, like you said, kind of at the beginning of this, which is essentially having like your first aid kit, right? Or not even a first aid kit, but just like your go-to kit, right? A bug out kit. And what's in that kit is going to be, some of the things we talked about, right? Like because you never know, like maybe someone comes over and they're freaking out, and, it's kind of nice to be able to be a great host. And I think this is why a lot of people like to come over to my place, because they can either do my cold plunge, or they can do, I got all kinds of crazy stuff here.
I'm sure you do. Yeah.
But, the thing is like, I love to have fun with it. And so I'll leave you with this question. And it's something that I've been asking people lately on the show. I've kind of gone away from asking the typical questions of like, what are you most grateful for, which is great, right? But if you weren't the Dr. Scott that you are today, the guy who is well versed in all things hyperbaric therapy and and knows all this stuff through transcriptions and home and hope, what would you be doing if you weren't doing what you're doing today? If you could not do what you're doing today?
Yeah, it's a really good question, right? I think my general sense is that I would be helping people in some way. I don't know exactly what that would look like, but I've always gravitated towards being of service to others. I think this is just how I grew up. I think it's kind of something in my heritage overall. My sense is that it would be something related to helping people in other ways that if I wasn't doing what I was doing now. That may be as a different type of practitioner. That may be as, it could be even as a teacher. I don't know. Like, it's hard to know. But I really do enjoy the process of working with people and educating overall on how to think about things differently. I don't think I would be a conventional person at all. I think I'd be looking at things outside the box. I think that in my world, outside of all of this, my sense is it would be very much similar to what I'm doing now and just other stuff, in the sense of if I wasn't doing hyperbaric medicine, I'd be working with some other technology. If I wasn't doing transcriptions, I'd probably be working on some other project that had something to do with changing physiology and working on biochemistry and things like that. So I think it'd be pretty similar. Now, if I live like, maybe kind of more interesting question is like, if I lived like 1,000 years ago, right? And I didn't have access to any of these kinds of things, what would I be doing then, right? And I don't know, maybe I'd be a shaman, taking people on psychedelic experiences. I have no idea.
Of course you would.
A medicine man somewhere in some native community. I think probably something like that. I think that's kind of a more interesting question to me, is like, if I had no capacity to do anything that I did now, right? It's just nothing like that existed, because it's like 1,000 or 10,000 years ago, and there's only human tribes around the world. I think most likely that's what I would do. I think in general, I have a pretty good intuition for and a feel for things, and that's kind of a natural aspect of what I do. So that's probably what I would do. I would probably be like, the medicine man of an ancient village 10,000 years ago kind of deal.
I can so see that.
Yeah.
And what's funny is at the beginning, I always like to try to guess what the person might say.
Yeah.
And you know what I thought you would say?
What I would say, yeah.
I thought you'd say you'd be a rapper.
A rapper.
DJ Scott shit.
Oh shit, man. Well, I used to be in a band back in college and medical school.
There you go.
And I did play a lot of music, but yeah, that was a passion. It was fun, but real down deep, I think it'd be more sort of the medicine man kind of thing. At least I think so. Who knows? But
I like it. I actually might readapt that question, in future podcasts, because it's like I could either ask a person, do they believe that we are alone in this universe?
Yeah.
Or which is also very interesting, right? But I've talked with you enough to know that, like, there's a certain level of understanding, and maybe we save those kind of questions for like another podcast. But I love to just find out what makes a person tick beyond what it is I know them for right now.
Yeah.
And so,
I get it. Yeah.
And you just never know, right? Like sometimes, like I've had people on here that were, I don't know, like pole dancers, you know what I mean? And
nice.
I had a young lady that was she was a professional wrestler, and she runs a company that does gut testing. And it's just like, it couldn't be more different, but how she got to that is an interesting story. So,
of course,
it's like things like that. So
yeah,
anyway.
I like the idea of taking or stripping it all out, right? And saying like, because all my mind goes to is like, I would be doing similar things, except they would be the things that I'm doing, right? But for other people, it's like, I'll be a rapper. Like, but for me, I'm thinking, well, if you stripped out every possibility, capacity for me to do anything that I would be doing now, and like put me back 10,000 years ago, like that's an interesting question to me, right?
Yeah.
Would I be the hunter? I wouldn't probably be the best hunter. No, I don't think so. Would I be like, good at, being the medicine man? I think I would. That's probably what I'd be better suited for. So anyway, it's a cool idea, right? Either way, I like where you're going. Rapper, huh? That's funny.
I'm gonna have to get you a do-rag, bro. I got one on hold for you, okay?
Yeah, the Beastie Boys did it. Maybe I can do it too, So
That's right.
You never know.
Very cool.
Yeah.
Well,
Yeah.
Scott, as always, I appreciate your time, your dedication to all that you do, and I hope that we get a good response from this, because it's obviously this is an opportunity for us to catch up and get to know each other even deeper.
Sure.
But ultimately, we want to help, right? And so I know that you are very helpful. I tend to be as helpful as I can. Can you explain to people the best ways to kind of keep tabs on what you've got going?
Yeah. So if you're interested in hyperbaric therapy or integrated technologies in general, so One Base Health is my company. We founded it several years ago. We're creating this sort of home ecosystem where all your devices, all your technologies, all your wearables are going to be connected in the same location. And we're very, very excited about it. We're coming out with our first derivation of this in November of this year. The first features will be the ability for you to use your hyperbaric chamber from your phone if you have a mild unit at the house. And so that's where a lot of the technology and software, a lot of innovation that I'm doing in that world is. If you're interested in consulting with me, I do consulting around the world in clinics and individuals. I have my own website there. You can go to integrativehbot.com. It's just the word integrative, the letters hbot.com, and that's where I do a lot of my consulting. I also have my own Instagram page at Dr. Scott Scher, DrScottSherr. You can connect with me there. I do some posting there as well. In addition, we have the Troscriptions company, which we've kind of talked a little bit about. Troscriptions makes a bunch of amazing products in the health and wellness space for energy, focus, immune system health, anxiety, stress, sleep, etc. And so you can find us at Troscriptions. Josh, I think you have a code as well for 10% off if anybody is listening. I think it's Josh10 if I'm not mistaken.
I believe so, yeah.
And so we can probably put that in the show notes for you.
Yeah.
And we're always making new innovative products there. And I think finally, if you're a practitioner and you're interested in more training, you don't have to be a licensed practitioner, but you're working with patients or clients and doing optimization, wellness, coaching, and you want to have a foundational framework. We have a nonprofit called Health Optimization Medicine and Practice, and the website is homehope.org. And we do training in a 7-module certification course for practitioners. And it's a great way to support your practice and the work that you're doing, because all of our patients need a foundation where they can make energy well, they can detox well, they have guts that are working, neurotransmitters that are optimized, hormones, etc. So that's the big part of that practice. And that's kind of the foundation of what I do with patients now. But I think that's a lot of places I know. So One Base Health, integrativehbot.com for me, at Troscriptions, and homehope.org.
Yeah, thank you for that. And I will definitely do my best to list everything in the show notes so you guys can just go right to it and click. And reach out to us, let us know what's up. And if you're cool enough to be in New York City and you're friends with me and you want to try out the chamber or some of these other things we talked about, let me know.
That's a very tough invite to get, guys. That you're listening. Yeah.
Serious inquiries only, right?
Yeah. My goodness.
Very cool.
Must have 1 million or more Instagram followers or something.
That's right. High engagement rate. Very cool.
Yeah.
All right. Well, again, thank you for your time, and for those that are tuning in to this point, thank you for hanging with us. And until next time, peace.
Simply walk the talk. Walk the talk, talking facts. Move like me, but I move a little fast. Make my move, here to last. Fasten these seatbelts, I'm coming past. Take care of me, longevity. Hack my biology, better believe. Walking the talk, soul, mind, and body connected. Better come give us a listen.